Good morning, good afternoon, good evening. What follows is a short introduction to the COVID-19 supply chain system. My name is Paul Molinaro. I am the Chief of WHO Operations Support and Logistics here in Geneva. What we'll go through is a brief overview of the COVID-19 supply chain system, introducing the supply portal that underpins the system and uploads demand, and how to access additional information. What I'll describe are three levels of what constitute the system. First, a task force requested by the Secretary General of the United Nations was constituted and has now met twice. This is made up of high-level members from UN agencies and selected partners. It's supposed to provide strategic direction and guidance. Second, we've established and formed three purchasing consortia. These are for the markets where we're finding the most challenges and where there are severe constraints in access. This is for PPE, for diagnostics, and for biomedical equipment, particularly for the provision of oxygen and management of severe and critically ill patients. Third, what we call the control tower is essentially the mechanism for consolidating the demand and working with the purchasing consortia, look at allocation, keep track of organizations that are ordering and procuring, and then finally bringing them into a central planning area to request delivery of those supplies through various hubs around the world. The four principles that underline this initiative are really there after analysis of the last few months to address the serious constraints and shortages that we're discovering in the supply chain of these items, included the rapid deterioration of transport networks that allow us to deliver as we normally would. First, we need to consolidate demand. This is clear to avoid overlap, duplication, and demand amplification. Second, we agree to collaborate our procurement efforts so that we can have a bigger voice in the market, aggregate our volumes, and get better deals, access, allocations, and pricing. Three, we agree on how we allocate. This should be based on critical needs, gaps, vulnerabilities, and the status of the epidemic in each country. And last, a singular distribution network that allows us to move volumes of product from origin countries through a network of hubs that have been established around the world and delivery up to named ports of entries in the various countries of concern. Now I will briefly describe the step process of how this system operates. First, as mentioned previously, consolidated demand. This is extremely important because it sets the stage and triggers all of the actions and activities that we undertake afterwards. First, we need the consolidated supply needs under the National Action Plan and identify who is requesting supplies. Second, identifying a funding source that underpins that request and then submit that request through the supply portal. Last, validation and prioritization of those submitted requests. And here we look to the national authorities, resident coordinators, and humanitarian coordinators to steer that process. Second, when we're coordinating our purchasing, we bring those requests in to the purchasing consortia, who are tasked with identifying supplying agencies based on efforts already made to acquire allocations of and quantities from various manufacturers. Two, the order will be confirmed and funding source with requester guaranteed. Three, we will then commit the supplies for distribution. When we move to our distribution system, we will be scheduling shipments with the various partners, and particularly with WFP, who are installing a series of supply hubs around the world in Guangzhou, Shanghai, Liège, Dubai, Kuala Lumpur, Addis Ababa, Johannesburg, Accra, and Panama. These hubs will serve to receive supplies coming from manufacturing countries and routing to end destination countries. Finally, countries will be receiving supplies as per the allocation and as per the partner that requested and who has authority to import the goods into the country. I'll now do a brief description on the functioning of the supply portal. Access to the COVID-19 supply portal is managed through the Partners platform by clicking the tab Supply Portal. The tab is only visible to country partners, country admins, regional admins, global viewers, and global admins. The tab is not visible to viewers and donors. Currently, separate sign-up login is required for the supply portal, but eventually systems will be merged, so only one sign-in is required. Should be noted that through this process, we use the word request, not order. There is no guarantee that the supplies will be provided. This is because we're in a situation where supply is not matching demand. This is why we are trying to address these issues through the supply consortia. But what it does do is allow us to log and aggregate and get a much clearer picture of what the actual demand around the world is. To join, you'll need to enter an email address from which a confirmation code will be sent to your inbox. Once you have signed up, you can start a new request. To start a new request, you will be brought to the request screen. If you have previous requests, they will be visible on this screen. If this is the first time, create new request to get started. Only one public health pillar should submit per request. If the requester is working across more than one public health pillar, submit a separate request for each pillar. Next, select the items. Select items from the catalog on the left. Each section expands. Add it to the request basket and add the requested quantities. Finally, we confirm the selection. Confirm the item selected. The estimated costs you see are for guidance only. They are working averages based on data we have from various different partners and are subject to change in these highly volatile markets. Indicate your public health pillar, indicate the financial partner, and provide shipping and contact information. The status of your request can be monitored on this screen here. You'll be able to see that your order has been successfully submitted, and you'll be able to see the status of your request. The order on screen is pending validation by the National Supply Coordinator. Supply coordinators at country level will be able to view submitted requests and will update the state if approved. This will be visible in the status field. Assign the order a priority. The legend is available in the top right-hand corner. Priorities sequence is as follows. First, COVID-19 frontline healthcare workers, including lab technicians and people swabbing for tests. 2, other healthcare workers. And 3, for infection prevention and control activities in other workers. Supply coordinators are appointed per country by resident coordinators, humanitarian coordinators. Once validated by the supply coordinator, the request will be communicated to the control tower for endorsement and allocation. Confirmation of orders will be made once suppliers are allocated. I do hope you found this briefing useful. For more information and training materials, please go to the Supply Portal training website. Thank you very much.